Here I am again. I know I've been gone a little while, but had to get back. There's been a lot of requests since the last. I guess it's there were three parts to the series that talked about my mental illness, me coming down with my mental illness 2 years ago. Shortly after the first day in the hospital, I did the first segment, which was about an hour long, and it was actually a practice for some speaking engagements that I did based on that whole mental illness manifestation that fell upon me in 2024. And then I followed up, I guess it was about 6 months later, because of all of the requests and the questions that came about because of that. And now, being about a year, well, about 6 months later, 8 months later, coming up on the 2-year anniversary of that first very bad day in my life, there's been a lot of questions about the progression. Has there been any progression of the illness? Has it gotten any better? The relationship aspect, that seems like to be the biggest part of the questions that come in. People having other relationship problems, or they're just fascinated by the length of time that I was married for 37 years, and then all of a sudden in one day it fell apart. So I thought I'd get on here and try, and I owe a podcast anyway, so I said, hey, I'm going to go on here and try to answer some of these questions that these folks have, that you were nice enough to take the time and message me. And there's been a lot going on, so I'm going to try to answer some of those questions. The relationship questions, I'm going to try to knock those out first, just like I always did before. That is a ship that sailed a long time ago. I do not talk to my ex-wife. I do not have any relationship with her whatsoever. I know it's sad. I know that's not what a lot of you wanted to hear, but that's what she wanted, and that's what she got. I mean, that's all I'm going to say there. For those of you that may be struggling in relationship issues or whatever, I don't know what to tell you. I mean, obviously I failed at mine, and I thought something totally different was going on than actually was for 37 years. So I'm not the person to ask about that. But that's pretty much done and over. We haven't talked in a long time, and we will probably never talk again. So case closed on that one. As far as the mental illness, I just had another hospital stay. This time at a big hospital, state hospital in Terrell, Texas. There's a lot of questions on a lot of the bulletin boards from a lot of folks that want to know, what are psychiatric wards or psychiatric hospitals like? You can tell so many people are got so much fear about these things. They don't want to go to them. You see the movies on Netflix or whatever, and you see One Flew Over the Cuckoo's Nest, and honestly, yeah, I'm not gonna lie, they're a lot like that. But when you're in that position, it's not as scary as what it looks on TV, and it's not as bad as what it looks. It's actually very comforting in some of those scenarios when you're in that environment, in that hospital. You're sharing some emotions, some pasts, some unknowns about the future with other patients, depending on which hospital it is or which unit it is or whatever. I'm speaking here in Texas. You may be in there with 22 up to 40. I've been in with 22 up to 40 some people, and you're not allowed. Most of them, you're not allowed to just hang out in your dorms. You have to go down into the day room in about 6:30 in the morning, and from there, you go. You got your chow times, you've got your rec times, you've got your group times, your therapy times. So they try to keep you active, and when you're in the day room, you're encouraged to mingle with the other folks and be sociable, and people open up with each other in there about their own challenges, and their own opportunities, what they're going to do when they get out, what they're going to do to heal, what they're going to do to cope. Talk about a lot of the groups that you go to in there, they cover things like that. They'll cover coping mechanisms, and they will cover healing strategies and mindfulness and all kinds of different things. So, a lot of the folks in there will be discussing with each other, hey, I can't wait to get out because I'm going to try this meditation thing, or I'm going to try, and it motivates people. And you'll, when you first get in there, you will look at, some of these people and think, I don't belong in here. You see someone talking to the wall, or somebody talking to their friend, or whatever, and I'm not belittling anybody. I'm not trying to make light of any of the situation, but that's just what goes on in there. And I'm not going to give any names or talk about specific people, but they're people with mental illness, and I myself, somebody, I just had a recent diagnosis, my assessment for this year, and going forward, and I was once again assessed with a very, very chronic and disabling type of major depressive disorder known as MDD, also post-traumatic stress disorder, survivor's guilt, and psychosis, and generalized anxiety. So mine's pretty severe, and a lot of the hospitals I was in, they were quick to say that, as much as ever, you may look around and see people doing odd things in here. I was one of the sickest people they've seen in many years. I have the hallucinations that go along with the psychosis. I have the delusions. I hear the noise, and a lot of people, it's quick for them to say, drugs or whatever. And it's easy for the doctors and the staff to evaluate you and rule that out. And any type of drug use or alcohol, that's been ruled out in my case. Mine stems, it's an illness, okay? And I probably had it my whole life. Some instances, some things that happened in the Marine Corps didn't help it, and some of the things that happened throughout my life didn't help it, and especially the thing with the relationship. So for those of you that are asking about what is a psychiatric ward or the hospital like, if you feel that you think you may need to go in there, or that may help you out, go down and check it out, man. They give very, very thorough assessments. They're not going to put you in there if they don't think you deserve to be in there, or if you're not going to benefit from anything in there. These people at these hospitals are by far some of the most smartest, most observant professionals I've ever seen in my life. I'd be shocked when I would go in, sit down, answer a few questions, or just start talking to them, and they would write down 3 pages. And when I would go and read them, they knew exactly what was going on in my head just by looking at me, or just by listening to what I said. And when they do their assessments to see whether you need to go in there or not, which they've done to me every time, and I've been in there 5 times, they had it. Exactly what was going on, better than I did. So go check it out. Don't be afraid. Especially if you're thinking about harming yourself, or taking your own life or whatever. go down there and talk to them. Don't. I mean, I understand the Facebook groups or social media and all that, but you know, at the end of the day, that's not going to help you. You're not talking professionals on there most of the time. I know there's probably some that get on there and try to help people out, but even me, you know, I'm not a professional. I'm somebody who deals with this day in and day out, night in and night out. I get up with it and I go to sleep with it, and I go through the day with it. So all I can tell you is my experiences, and mine are going to be a lot different than a lot of other people's. You know, when you're in these hospitals, you're in there with, you know, I got the MDD and psychosis and anxiety. You're going to be in there with bipolar, schizophrenia, manics. I mean, you know, people, you know, with all kinds of different disorders and illnesses and, you know, mental health issues. And usually, you know, there's a couple different units at these places, and I have not been in the unit where, usually there's a unit where there's, you know, drug rehabilitation and stuff like that. So if you do have a problem with that, you know, another reason to go check it out. I have been in Glen Oaks in Greenville, Texas, and I've been in up in by Lake Texoma in Sherman, and I've been in Terrell, Texas, the State Mental Hospital, and they've all been fantastic. The people have been great at each. Terrell, I mean, you hear horror stories about it, but I tell you what, the staff there was fantastic, and the doctor is one of the best I've ever seen, Dr. Jane. And my social worker there was great too. So a lot of what you get, I mean, the first time I was really scared. I went back to Glen Oaks a second and third time. But after that first time, I mean, I was no longer scared. I'm not scared to go to any of these hospitals because they're comforting in a way. Sometimes you just, you know, you got to get away. I mean, and that's what the hospitals are for. They're a triage. They are for stabilizing you when you're in a bad spot. There's not a lot of therapy that goes on in there, other than the mingling with the other folks that are in there, the groups that you go through, but not a lot of intensive therapy, because again, these are stabilization, getting your meds on track the way that they're supposed to be, and you know, getting you ready to get back out into society and into a routine where you can regularly go see a mental health professional. So when you're in there, it's going to be, you know, you don't expect to come out of there healed, but do expect to come out of there ready to take on, you know, the challenges that are out there, and be committed to following your treatment plan. And you'll learn a lot from the groups too. And you may learn something. I mean, I came out and started painting, became an artist. I didn't know I could, you know, that I was able to do that, and I learned that in there. I will tell you this: you may you get in there and you see some things, and you may think this, oh, the staff's mean, they're assholes. You know what? When you think about what they got to deal with on a daily basis, all they're doing is trying to keep everybody safe. And I'm sure they get frustrated sometimes, but almost every single staff member at every hospital that I've been to, they're there for a reason. They've been through this or something like it before. Believe it or not, as widespread suicide is, I have not been in the hospital with a lot of people, if any, that that were people that have tried taking their own life or anything like that. As a matter of fact, a lot of people were very surprised when they heard what I had did, and as many times as I've tried it, and I've been on life support a couple times because of it. And trust me, I don't look for sympathy in these cases, and I'm very transparent about this stuff. I tell everybody about it. I kind of, I try to make light of it. I joke about it. But I want everybody to know what they're dealing with. And when they see me doing something crazy, like looking at something that ain't there, I want them to understand why. And people can laugh at me and all that. I don't care. And why I say that is for many years, I was on the other side of the fence. Up until I was 54 years old, I didn't think anything like this existed, and I would have questioned people that behaved like I do now. So I'm just, I'm getting what comes around goes around. So I understand what it's like to be on the other side. Until you face something like this, you just don't know. It does it does sadden me how many people I see with such severe mental illnesses, and the young folks, that, I mean, I made it to 54 years old. I've been in the hospital with kids, 18, 19, 20 in very, very bad shape. Sometimes because of things that have already happened in their life, and other times are just, sometimes your brain just don't work, the way other people's do. So that, that kind of covers the questions about the mental hospitals, the psychiatric wards. Go, if you think that if you ask the question, you should probably go get an assessment. I want to talk about the suicide thing. And trust me, this is one that I'm definitely not an expert on, because I have not kicked it. All I'm going to say on this one is, what I've learned is it makes things harder every time if you try it. If you do try to harm yourself or take your own life, it doesn't. If you, and it's a lot harder than what you may think. But when you come out of that, the whole situation's a lot worse. I can tell you that. What I want to talk about next is, and it's something that I struggle with sometimes, but it's about what other people think about you, what they talk about or whatever. Because you're you're not the same person you were at one point in your life. I didn't cry, my whole life, and then for a year straight I cried for I don't know why. I mean, when my brain went sideways, and now it happens all the time. I laugh, cry, puke, spit, whatever, and I don't know why. So, and in front of other people, in front of friends that think probably, he's crying like a sissy or whatever. They don't bother me again, because I'm just trying to, when I'm not in the hospital, or when I'm not bedridden from trying to do something to myself, I'm just trying to get through the day, man. That's it. Yet with all the thoughts that run through my head, the things that I see and hear. So, you just gotta put your pride aside a little bit sometimes, and accept the cards that were dealt, and think about the people around you, and make sure they don't suffer harm because of something you do. And remember that there are a few people here and there that still care. So there's that. Other than that, I don't know a lot more on what to say. I covered the relationship thing. Now, is it hard to move on to other relationships after something like that? Of course it is. 37 years is a long time. But I think the relationships that you have after that are a little more healthy. Uh, Not, you know, you don't take everything as serious, and you're more, you know, friend, you know, you care about each other more like friends when you're at this age, and uh, the fighting with each other and all that it just doesn't happen. There's no need for it. Uh, I covered the mental hospitals, and if you have any questions about these things, you know, again, hit me up on YouTube or Facebook. Tom Who Is Me on Facebook. TomTomBloomer@gmail.com is my email. Feel free, and I'll try to answer the best I can. Again, you know, 56 years old. It hit me when I was 54, and nobody, you just can't explain it. People ask the questions I can't answer is, what's it like? What's MDD like? And it's unexplainable. It's when I say I wouldn't wish it on my worst enemy, that's the truth. Because it's like, it's not like your dog dying, or, you know, even a parent or dying. It's nothing like that. It's a you don't even know why. You don't know where it's coming from, and the feeling is, it's just, it's like your soul being sucked down into a vacuum. I mean, it's just horrible. That's the worst part. You know, the psychosis sometimes can actually be kind of comical, as long as you know that what's going on is not real. And the anxiety sucks without a doubt, but it can be controlled with medicine. The racing thoughts and things like that suck, but you know, that's where they teach you them coping mechanisms. So it's challenging, and for you folks that are dealing with this, I feel for you, and like I said, anything I can do to help you, hey, I'm here, man. I'll answer the best I can and be as honest as I can. And you can be as straight and blunt with the question. If you're one of those skeptics out there or haters, and you just want to tell me how fucked up I am, you know, I get that too, and you can do that too if that helps you. So anyway, thank you, and that's pretty much all I'm going to talk about today. And 'cause I got another podcast to do on some business stuff, but thank you.